Hello, ATG, and good morning, everyone. Once again, Dr. Alalade here at AsktheGynaecologist, and this morning, I think I have some few minutes before I pop in to work. So I want to quickly talk about ovarian cysts. I was supposed to talk about this yesterday, but time did not permit me. Yesterday was Monday, bank holiday, public holiday in Nigeria, as we all know. And we discussed so many topics yesterday, and I'm sure people learned a lot. Today, this morning, before I pop out to work, I want to quickly talk about ovarian cysts and what sort of cysts affect and can cause infertility. So if you're free, join me quickly and let's have a quick chat together. I know most of you are on your way to work, or possibly taking kids to school, or possibly doing some quick money errands, and we're starting back the new week. It's a wonderful time to be alive. I give God the glory for everything He's done and for His mercies upon us. Most importantly, we thank God for the gift of life and for the gift to be alive. That's the most important thing. As far as there's life, always remember that there's hope. No matter what you're going through, no matter your challenges, no matter your difficulties, as far as there's life, as far as you're still kicking, you're still consuming something, you're still drinking water, you'll still be able to eat your food, there is hope. And once there is hope, there is opportunity to make a difference in this world to people and to yourself, most importantly. Good morning, Mercy Odiwo, Christina Aladumoyedo. Thank you so much. Unfortunately, I'm in a car and I don't have my whiteboard, I don't have my models to explain things. So I'll rely on you to use your power of imagination and to understand me and to flow with me as I talk this morning. I've seen so many requests from people over email, messenger, and so on and so forth. And I want to tell you that, okay, to be honest with you, I don't open my messenger anymore because it's full, about close to 10,000 messages. It's difficult to read them. In fact, it's going to take me to employ somebody to go through them. I'm not saying that I don't want to answer people, but the amount of requests we get is difficult to go through them. Most importantly, I have to go to work every day too, just like most of you. So that's why we have different groups so that we can get people to answer people as soon as possible. We have the premium services, we have the GTC, the antenatal. Dr. Esther is there, the moderators are also there, and we have many facilities available for you to go through our things and to get across to us. So if you want to get direct information from me or you want to consult with me directly, you have to go through the premium services. I'm not able to go through all the messages on Messenger. So while going through some messages yesterday, I saw some questions about ovarian cyst, and people are worried about it causing infertility. And I've chosen this morning again to go through ovarian cyst again to see and to explain things to people. Basically, ovarian cyst, it's when there's a tiny cyst. Basically, a cyst is like a blister, like an extra attached blob, okay, to the ovary. Imagine your ovary is as big as agbalumo. You know that fruit that people suck in season during summer, during the wet season in Nigeria. Agbalumo, I think it's a hard food to soak. That is the size of a typical ovary. Or imagine a walnut fruit, about 1.5 of it. That's a typical size of an ovary. Okay, left or right. Okay, some ovaries can become as big as my head. That is not good. Okay, and those can also cause fluid in your tummy. And when I say fluid in your tummy, I don't mean small fluid that they see in part of dogs. I mean massive fluid called ascites, fluid as big as 1 liter of fluid in your tummy. Those are bad cysts. That's likely to be ovarian cancer or MEG syndrome for those that are not in menopause. I'm talking of cysts on your ovary. So your ovary is as big as a one agbalumo or 1.5 size of walnut fruit or walnut, that walnut people eat, or almond, whatever. I'm not sure what it is. So the ovary is typically like that, and your ovary does not cause pain. If you're having pain on your left or lower abdomen, or you're having like a temperature heat, people say I'm having heat sensation in my lower abdomen, let me tell you something. Think along with me. When you open the tummy of a man, I'm a man. Only two things you see there is my bladder and my bowels. Bowels including my liver, gallbladder, everything, pancreas, everything, spleen. That's all. For a woman, you see this same thing, and ovaries and tubes and womb. That's all. There's nothing else in that tummy. Once you pack away your intestine, what is left in your tummy as a lady watching me is your womb and ovary and your bladder. So if you're having this warm sensation that people describe in your lower abdomen, it's either for you to check your urine for infection, or check your ovaries for ovarian cyst, or check your womb for any fibroid or anything in your womb. That's all. Then check and do scan to check your liver, gallbladder, spleen, kidneys, to see if there's any other thing wrong. That's how we think. That's how I think, to figure out what could be wrong with you. So if you're having this pain, this hot sensation in your lower abdomen, don't panic. Simply go for a scan. And under your scan, maybe they found a cyst on your ovary. Don't panic. In most cases, I tell people all the time, in most cases, if you have a cyst on your ovary, less than 4 centimeters, what we do is to look into that cyst on the ovary. And if it contains only fluid, we call it a simple ovarian cyst. A simple ovarian cyst is not cancer. A simple ovarian cyst does not cause infertility. And in most cases, a simple ovarian cyst would not cause pain. Okay? And if it's a simple ovarian cyst, what we can do, as far as it's not causing you pain or any problem, in most cases, we find it incidentally, just by accident, just because we are scanning. We don't panic. We repeat your scan in about 3 to 4 months down the line. Worst case scenario, 2 months, but in most cases, 3 to 4 months down the line. And most simple cysts will disappear on their own. I've seen it countless of times before. However, if we scan you in 3 to 4 months' time to check that ovarian cyst again, and probably peradventure is getting bigger, and the content inside that cyst is changing, then it could be worthwhile to consider rescanning you or taking out the cyst. Most importantly, if this cyst is getting bigger, maybe increase from 3 centimeters to about 7 centimeters, 8 centimeters, and you have the same cyst, for example, on the other ovary, or maybe it's just on one ovary, and probably you've gone through menopause already, you're 48, 50 already, at that kind of time, we'll consider taking out the cyst and taking out the ovary, because you probably don't need the ovary anymore. By your 50, 60, you've probably completed your family. As far as you give me certification that you've completed your family, you don't have any more children, I'll think of taking out the ovary. By taking out the ovary, I remove any risk of you having any disease any further from your ovary. If a lady that is still having babies comes to me, we can see ovarian cyst on that ovary. I scan her back again in 4 weeks, 4 months down the line, the cyst is getting bigger. What I'll do in the first instance is consider advising her what to do. You will consider taking out that cyst on the ovary, but I also warn her that during the operation there could be a risk of her losing that particular ovary. The reason is that because she's still going to have babies in the nearest future, I want to conserve and save her ovary. And in most cases, worst case scenario, if she loses that ovary, we'll keep the other ovary so that she can still have and procreate more children. As far as you're still ovulating and that other ovary is okay, chances of pregnancy is still there and very good. But if I scan a lady and I can see an ovarian cyst, and that ovarian cyst on scan cyst is a complex cyst. Complex cyst could, most cases 80%, if you're still within under age 50, a complex ovarian cyst is not for you to panic. And in most cases, it's benign. Benign means it's not cancer. Okay? If we see a complex cyst, what does it mean by saying we see a complex cyst? Remember I mentioned that a simple cyst contains only fluid inside them. A complex cyst can contain more than fluid, maybe blood. Okay? Sometimes we call it hemorrhagic cyst if it contains blood. Hemorrhagic cyst. Hemorrhagic cyst is basically it's a simple cyst, but that person has bled some few blood into that cyst and it's become organized. We call it hemorrhagic cyst, and in most cases too, they disappear on their own too. Worst case scenario, we go in and drain that cyst or take out that cyst on that ovary particularly. Sometimes too, we can scan you and we can see a complex cyst. Maybe that cyst contains some other particles inside them, and you're under 50, you're under 40. We call it a dermoid cyst. Dermoid cyst is also benign, it's not cancer, just that it contains other particles inside, which makes it look more grayish on scan. We call it the dermoid cyst because it's not cancer, it contains other particles apart from blood. Some cases, dermoid cyst can contain wax, wax, hair tissue, skin tissue. Okay? The ovary has the power, what we call is a totipotential multipotential cell. In the ovary, you have many cells that can develop into any part of the tissue of the body. So the ovary is a storehouse, bank house, storehouse of all the complement tissue in the body, and it can differentiate to any part of the body. Based on that fact, the ovary can form what we call a dermoid cyst that can contain even teeth particles, hair, wax, skin, epithelial tissues. That is the dermoid cyst. We take them out. It's not cancer. It's benign. It can happen in people that are under 30, under 40. Very common under 30. It's not cancer. In some people too, under that age, 30, 40, we have what we call a MEG syndrome, where they have a big cyst on the ovary, which is not cancer, and it contains so much fluid in the tummy and even in the chest. In such cases, we need to drain that fluid in the chest and tummy and take out that cyst that is already big. In most cases, we are able to conserve the other good ovary. As people get older, 60, 70, if I see a 60-year-old lady with a big cyst on the ovary, as big as this on the ovary, and she has so much fluid in her tummy and she's losing weight, the odds of it being a cancer is almost 90%. And in such cases, what you want to do is to quickly refer them to a cancer specialist, what we call gynaecologist, so they can deal with that cancer of the ovary. But we can do some tests. We take some fluid in their tummy, take some blood tests, and also some sample tissue of the ovary to confirm what disease this is. This is highly important, that if you see anybody above 60, 70 in your area surrounding, and that person has a big tummy, okay, that person is losing weight, and there's so much fluid in their tummy, they're not pregnant though, 60, 70 is not pregnant though, is probably cancer of the ovary. Cancer of the ovary sometimes presents late and can heal very fast. It's very rare in the younger age group, but it can happen too, but it's very rare. If in your family you have higher risk, or people in your family, your auntie, your mommy, your auntie, your siblings, they have cancer of the breast, cancer of the ovary, you are at slight increased risk of having such things. If your mommy, your sister, your auntie, they have cancer of the ovary or breast cancer, careful. You need to do careful and start watching out, or see a doctor so that we can go through your risk and review your story, and we can know whether you are at increased risk of developing such diseases in yourself, and we can give you further advice on what to do. I need to go out now to work. I'll take some few questions now so that I can go, and I hope people watch this video over again to get some few nuggets of information that can change lives, that can change story. Now, what sort of cyst will cause infertility? Most cysts will not cause infertility. Yes, that's a fact. Sometimes though, if a cyst on the ovary twists on itself, by it twisting on itself, we call it torsion of the cyst. By this ovary cyst twisting on itself, it can cut off its blood supply while it's twisting on itself on the ovary, because it's so long, it's so big. While it's twisting on itself, it cuts off the blood supply, and it can cause pain on that side, left or right. By twisting on itself, it can also cut off the blood supply to the tubes too, and it can destroy, decay, damage, and make the tubes left or right dark and damaged. Ovarian cyst rarely causes infertility, but if they cause such twisting on that ovary or on that tube, then that ovary might be dead. Very rare though, that ovary might be dead. In such cases, we have to remove that ovary and that tube. Some people too, they have what we call endometriotic ovarian cyst, basically endometrioma or endometriotic cyst. This cyst on the ovary is from endometriosis. Some people have endometriosis on the ovary, and that stuff on the ovary, which is endometriosis on the ovary, can cause a cyst containing blood on the ovary and can damage the tubes and the ovary, and such will cause infertility, or they can cause infertility. Polycystic ovarian, and the latter one is polycystic ovaries. Polycystic ovaries is not ovarian cyst. Ovarian cyst is a separate cyst, separate attachment on the ovary. Polycystic ovaries is when we open the ovaries, there are cysts within the ovary. Ovarian cyst is a cyst outside the ovary. Polycystic ovarian cyst is cyst within, inside the ovary. Polycystic ovarian cyst does not cause pain, but it's also a possible cause of infertility. Polycystic ovarian cyst is the number one cause of hormonal imbalance and the number one cause of infertility in the world today. But it does not cause pain. Polycystic ovarian cyst does not cause pain. Ovarian cyst will cause pain. Ovarian cyst can cause pain, but polycystic ovarian cyst does not cause pain. Ovarian cysts rarely cause infertility, but polycystic ovarian cysts usually and can cause infertility. Am I making sense? Polycystic ovarian cyst, polycystic ovarian syndrome does not cause pain. It can cause infertility. Okay. Now, and how does it cause that? It increases the imbalance and causes imbalance in your hormones, especially your LH. So therefore, you're producing cysts to release. You're producing ovarian cysts to release. You're producing eggs to be released, but those eggs don't get released. It's like when you see chicken on the farm, they lay eggs, but those eggs don't hatch. This is the same idea too. Polycystic ovarian syndrome makes you produce eggs, but those eggs on your ovary do not hatch. They don't release the egg that will go into the tube to get you pregnant. So we have to deal with them. We have to destroy those tiny cysts within the ovary. Sometimes we tell you to lose weight. Sometimes polycystic ovarian syndrome is associated with diabetes type 2 in pregnancy, diabetes type 2 before pregnancy. So we focus on treating your sugar level if you have high level of sugar, and that can make you to ovulate. But first things first about PCOS, polycystic ovarian syndrome, is for you to lose weight. People will say, doctor, I'm not overweight now, I'm so thin. Tell my sister, I've seen people complain about that before the time. When you check their BMI, they're overweight. Just try and lose at least 2 to 3 kilograms and focus on regular exercise. Exercising at least 30 minutes every day for at least 3 days a week. You see a tremendous change in your weight. And by losing small weight, makes you ovulate, and within 2 to 3 months, you get pregnant. Well, people find it difficult to say they want to lose weight because they think Nigeria, what are we eating and that we are overweight now? People can be overweight too, and people can be underweight too. Overweight is a very common thing now in Nigeria, that especially in Lagos and all those big cities. Now people are eating cold stone pizza, everything. I'm not saying you should not enjoy, but do it in moderation. Lose weight. You see total difference. Somebody said they have a complex cyst on 7 centimeters on the ovaries. You're trying to conceive. First of all, go and remove a cyst of 7 centimeters. A cyst more than 5 centimeters, I suggest, as far as it's complex cyst, just go and get it out. Doctors, remove those cysts, okay? Just remove them. After removing them, let's do an HSG to check your tubes are not blocked. After checking your tubes, the next thing is to check your husband's sperm count and your other hormones to see that they are balanced and they are ovulating. Once that is done, in most cases, you're able to ovulate and get pregnant. But that cyst, 7 centimeters, get it out. Get it out. Okay, if you're pregnant already, don't wait until you miscarry before you join the antenatal care. I tell people all the time, you're pregnant. The purpose of joining ANC and ATG is for you to walk you along through your pregnancy. And if you're trying to get pregnant, you don't want to join the premium services, probably it's expensive for you, you can join the GTC. And if you've been on the GTC and your plan has expired, please subscribe again and send your payment evidence to our moderators or to our email, atgservices2018@gmail.com, and your subscription will be reactivated. If you've subscribed before for ANC or GTC, last year is expired, you want to resubscribe again, pay now and send your payment evidence to our email, atgservices2018, atgservices2018@gmail.com, and then you'll be re-added. For the GTC, it's changed from the old price, is now 7 grand. For the ANC, is now 7.5. The old prices of August last year is gone. It was changed August last year. Okay, so take note. All right. Yvonne, thank you so much. Chime. Prolactin, not the Adeyemi Oluwakemi. There's nothing called prolactin. It's prolactin. Prolactin is a hormone that helps you to produce breast milk. The way the body works is that if you're producing breast milk to nurture a baby, your body wants to focus on that baby nurturing and stop you from getting pregnant. So if you have high prolactin but you're not nurturing a baby, that is disharmony in the brain, in the body. That is disease. You're having high prolactin, but there's no baby to nurture. That is confusion in the brain. By you having high prolactin, it means you're not ovulating. By you not ovulating, naturally you're gonna have a challenge getting pregnant. So to treat that, to ovulate, we have to bring your prolactin level down. And how do we bring your prolactin level down? If you have high prolactin, we give you medications to bring your prolactin level down quickly. And while you're on the medication, we check your prolactin level every 4 weeks to see that you're responding. And if you're not responding, we increase the medication dose or we change the medication dose. If you want to pay to ATG services, you're in Japan, you can do bank transfer to Nigeria. There are many ways now to send money to Nigeria now. We have all the payment links on Flutterwave. I don't think we have Japan link, but we can get that as soon as possible. But if you have a bank account in Nigeria, just tell your people in Nigeria or your account in Nigeria and pay the cost of your service you want to choose to a bank account, and it's so easy. Wherever you are in the world, you can do payment. You can even go to online and do transfer to our account if you have to join our services. Again, you don't have to join our services, but if you want that one-to-one discussion with us, then you have to join the premium services. But if you want to just enjoy free lectures, we are here. We are here for you. Free every day, free lectures, talk on ATG to get you knowledgeable, free on ATG here, free. But if you want one-to-one discussion, obviously you have to go to the premium services. Okay. Thank you, Chichi Oji Inzenagu. Elizabeth, thank you so much for attending to Colette Ebot. Thank you so much. I need to go to work now. I'll be seeing you later in the day. And God bless you all. And thank you once more for attending our talk today. I love you all. Most importantly, I love myself too, And see you. Have a wonderful day. Have a wonderful rest of your week. God bless you.
Alalade.com.